Right now, before you skip this video, I want you to think about the last time you looked. Not at your phone, not at your food, at your own urine. Most people never do. They flush and forget. But here is what no one tells you. That color, that specific shade you saw this morning, is one of the most accurate, real-time diagnostic signals your body produces every single day. Your kidneys are filtering 200 liters of blood every 24 hours. And the color of what comes out tells a story about your kidneys, your bladder, your prostate, your brain, and even whether your red blood cells are rupturing right now inside your body. Today on Health Say, we are going to decode all 5 major urine colors: white, light yellow, yellow, brown, and red. We are going to show you exactly which organ each color is connected to, what is happening biologically when you see it, and which ones demand a doctor visit within 24 hours. Stay through the end, because color number 5 is the one most people dismiss as nothing, and it is the one that kills. Before we go color by color, you need to understand one molecule. It is called urochrome. Urochrome is a yellow pigment produced when your body breaks down old, dead red blood cells. Specifically, it comes from the breakdown of a molecule called bilirubin in your liver. This is important. Urochrome is always present in healthy urine. The concentration of urochrome, diluted or concentrated, is what creates the spectrum of colors you see. When you are well hydrated, urochrome is diluted. Your urine is pale. When you are dehydrated, urochrome is concentrated. Your urine goes dark. But here is where it gets serious. Some urine colors are not urochrome at all. They are something else entirely: blood, bile, bacteria, or protein. And that is when color becomes a warning. Think of your urine as a daily report card from your internal organs. Most days, it's fine. But some days, it is screaming at you. Let's read it. White color P. White or completely clear urine. Most people think this is perfect health, a sign they are drinking enough water. Here is the truth. Completely clear urine, every time, all day long, can actually be a problem. When urine is totally colorless, it means your kidneys are producing a massive volume of dilute fluid. In a healthy person who just drank a large amount of water, this is temporary and normal. But if your urine is consistently colorless throughout the day, even when you wake up in the morning when it should be concentrated, that is a signal worth investigating. 3 conditions cause chronically clear urine. First, overhydration. Yes, you can drink too much water. This condition, called hyponatremia, dilutes the sodium in your blood to dangerous levels. Your brain cells begin to swell. Early symptoms include nausea, headaches, and confusion. Severe cases can cause seizures and coma. Second, diabetes insipidus. This is not the diabetes most people know. This is a condition where your pituitary gland fails to produce enough ADH, antidiuretic hormone, the signal that tells your kidneys to conserve water. Without it, your kidneys produce enormous amounts of dilute urine, sometimes 10 to 20 liters per day. You become dangerously dehydrated even while drinking constantly. Third, certain diuretic medications, including some blood pressure drugs, force your kidneys to eliminate excess fluid. Organ focus. Kidney. Clear urine tells us the kidney's concentration mechanism may be impaired or simply overwhelmed. The kidney's ability to concentrate urine is a key marker of long-term kidney health. What to do? If your urine is always completely clear and you are not consciously overdrinking, mention this to your doctor at your next visit. Light yellow color P. Light yellow. Pale straw. This is the gold standard. This is what your body looks like when it is operating at its best. This color tells you 3 things simultaneously. 1. Your fluid intake is appropriate. You are giving your kidneys the volume they need to flush waste efficiently. 2. Your liver is processing bilirubin correctly, producing the right level of urochrome. 3. Your kidneys are concentrating urine to the right degree, not too dilute, not too concentrated. This is the color your bladder sees when it is happy. When urine is the right concentration, it is less irritating to the bladder lining. People with chronic overactive bladder or interstitial cystitis, a painful bladder condition, often find significant symptom relief simply by achieving and maintaining this pale yellow color consistently. Organ focus. Bladder. The bladder lining, called the urothelium, is sensitive to the chemical composition of urine. Consistently pale yellow urine reduces bladder irritation, lowers the risk of crystal formation, and helps prevent the conditions that lead to recurring UTIs. Target this color. Every time you walk into a bathroom and see pale yellow, your body is in balance. Dark yellow color P. Deep yellow. Amber. This is your body's first warning that something is shifting. At this stage, your kidneys are beginning to concentrate urine because fluid intake is falling short of what the body needs. Urochrome concentration rises. Your urine output decreases as your kidneys try to conserve water. But the organ that suffers most invisibly at this stage, and the one most men over 40 never think about, is the prostate gland. Here is a fact that should stop you. Benign prostatic hyperplasia, or BPH, an enlarged prostate, affects over 50% of men by age 60 and up to 90% by age 85. The prostate wraps directly around the urethra, the tube your urine flows through. When the prostate enlarges, it squeezes the urethra. Flow slows. The bladder has to work harder. Urine sits longer. Concentration increases. Dark yellow urine in a man over 40, especially combined with a weak stream, frequent nighttime urination, or a feeling of incomplete emptying, can be an early composite signal of BPH. But here is what makes this dangerous. BPH shares early symptoms with prostate cancer, and most men ignore both until the problem is severe. Organ focus. Prostate gland. The prostate is a walnut-sized gland. It should never obstruct urine flow. If you are consistently producing dark yellow urine and notice any change in your urinary stream, ask your doctor for a PSA test, prostate-specific antigen, at your next checkup. For women, dark yellow urine combined with pelvic pressure or urgency can indicate urinary tract infection or pelvic floor dysfunction. Both are treatable, but only if caught early. The fix at this stage is often simple. Drink water. But the warning is real. Brown color P. Brown urine. Cola-colored. This is no longer a lifestyle adjustment. This is a medical signal. When urine turns brown, there are 3 primary causes, and every one of them requires medical attention. Cause 1. Severe dehydration. When the body loses more than 3% of its total water volume, cognitive function begins to deteriorate. Research from the University of East London found measurable reductions in brain tissue volume, visible on MRI scans, after just 90 minutes of moderate exercise without fluid replacement. At severe dehydration, your brain physically shrinks away from its skull, pulling on the meninges, the membranes surrounding the brain, causing intense headaches. Brown urine from dehydration means your kidneys are under extreme stress. Prolonged, severe dehydration can cause acute kidney injury within hours. Cause 2. Rhabdomyolysis. This is a condition where muscle fibers break down rapidly from extreme exercise, a crush injury, or certain medications, and release a protein called myoglobin into the bloodstream. Myoglobin is toxic to the kidneys. It turns urine dark brown or even black. This is a medical emergency. Left untreated, rhabdomyolysis can cause complete kidney failure within 48 hours. Cause 3. Liver failure and bile in the urine. When the liver is severely damaged, from cirrhosis, acute hepatitis, or bile duct obstruction, bilirubin builds up in the bloodstream and spills into the urine, turning it brown. This is called bilirubinuria, and it is one of the clearest signs of liver stress you can observe without a blood test. Organ focus. Brain. Your brain is 73% water. It has no water reservoir. It depends entirely on your moment-to-moment hydration. Brown urine means your body is so fluid depleted that your brain is operating in a compromised state. Reduced reaction time, impaired memory formation, elevated cortisol, and increased risk of neurological events. If you see brown urine and you have not exercised intensely, drink water immediately and seek medical attention if it does not clear within 1 to 2 voids. Red color P. We save this one for last. Not because it is the rarest, but because it is the most dismissed. Red or pink urine. Most people's first thought, I ate beets. And sometimes, that is correct. Certain foods, beets, blackberries, rhubarb, contain pigments that temporarily tint urine red. This is harmless and clears within 24 to 48 hours. But red urine that is not explained by food is one of the most important symptoms in all of medicine. It is called hematuria, blood in the urine. There are 3 categories. Category 1, kidney stones. Stones moving through the ureter, the tube between your kidney and bladder. cause microscopic tearing of the urothelial lining. Blood enters the urine. This produces pain so severe it has been described by patients as worse than childbirth. But some kidney stones cause painless blood in urine, and these are the dangerous ones because they are easily missed. Category 2, bladder cancer. This is the critical one. Painless, intermittent blood in the urine is the #1 presenting symptom of bladder cancer. It accounts for 90% of initial bladder cancer diagnoses. The fact that it comes and goes, appearing for a day, then disappearing for weeks, leads most people to ignore it. They should not. Bladder cancer caught at stage 1 has a 5-year survival rate of over 90%. Caught at stage 4, it drops to under 15%. Category 3, hemolysis, blood cell rupture. When red blood cells rupture in the bloodstream, from conditions like sickle cell disease, certain infections, or a severe immune reaction, hemoglobin is released directly into the bloodstream. It spills into the urine, turning it red or brown without any actual bleeding occurring. This is the condition your thumbnail calls blood hemolysis. It is a systemic crisis. Organ focus, blood vessels and bladder. Red urine is a vascular and urological emergency until proven otherwise. It is not something to monitor at home for 2 weeks. It demands a urinalysis, a urine test, within 48 hours at minimum. If you see red urine that is not explained by food, do not wait. Contact your doctor today. Let me give you a simple system you can use starting today. Every time you use the bathroom, look before you flush. You do not need a lab. You need 3 seconds and the knowledge you now have. White to light yellow. You are hydrated. Your organs are receiving what they need. Continue what you are doing. Yellow to dark yellow. Drink 500 milliliters of water in the next 30 minutes. If you are male and over 40, note whether you experience any urinary flow changes. If you see this color every day despite drinking, see a doctor. Brown, drink water immediately. If it does not clear within 2 urinations, seek medical attention. If you have muscle pain alongside it, go now. Rhabdomyolysis does not wait. Red or pink with no food explanation, do not wait. Do not watch videos. Call your doctor today and request a urinalysis. If you are over 45 and this is painless and intermittent, ask specifically about cystoscopy, a camera examination of the bladder. Early detection saves lives. One more thing, medications and supplements can alter urine color in ways that mimic warning signs. Rifampicin, an antibiotic, turns urine bright orange. B vitamins turn it fluorescent yellow. Certain chemotherapy drugs turn it blue or green. If you are on medication and see an unusual color, check the drug's known side effects before panicking. But when in doubt, always ask your doctor. Your body is communicating with you every single day. Not with pain, not with visible symptoms, with color. Most of medicine waits for disease to become loud. Your urine color is disease whispering before it has to shout. You now know what white means, what light yellow means, what dark yellow, brown, and red mean. You know which organs are speaking through each color, and you know exactly when to act. The difference between an early kidney stone and a surgical emergency is often just one ignored brown void. The difference between stage 1 and stage 4 bladder cancer is often just one dismissed pink morning. Look before you flush. If this video gave you information you did not have before, share it with someone who needs it. Leave a comment below. What color is yours right now? Let's see the data. I'm HealthSay. We visualize health. We think deeper. And we help you understand your body. See you in the next one.